Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila Institution. We're a bunch of policy nerds based in Bengaluru, and we like to bring a fresh perspective to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to another episode of All Things Policy by the Takshashila Institution. Today I've got with me Dr. Harshit Kukreja, a colleague of mine at Takshashila who researches on biology and policy. And today the subject of our conversation is going to be on COVID-19 and the social dilemmas that had arisen out of the pandemic. So as I said, your COVID-19 pandemic presented a unique social dilemma as the actions to prevent the spread of the disease affected both the individual and others. And there were also differences in risk among individuals, leading to a dilemma of whether low-risk individuals will incur the cost of prevention behaviors to reduce collective risk for those who are more vulnerable. Now, that's a very long-winded way of, sort of setting the context. So let me just do the easy thing and ask Harshit to come in here and just give us a gist of what this conversation is going to look like.
Hey, Carl. Thank you so much for having me. Yeah, at Takshashila, we have been looking at basically public policy problems and in a broader way, social issues and society from a biological reasoning viewpoint. I think this series has been going for too long, and people who don't know, we'll just put a link in the description so that they can get an introduction. So, COVID-19 was pretty unique on the changes it brought to society. First of all of my understanding, there's a very nice paper. I'll just put the link. It was released in 2022 and it describes human cooperation, climate change, COVID-19, and to some extent, misinformation. It's a very nice paper from Netherlands and MIT. So, COVID-19 was a very unique situation. The fact that COVID-19 was infectious laid the groundwork for what we call a social dilemma. First of all, the thing was that because it was infectious, whatever I did affected my health and also affected the health of others around me. So therefore, there are like certain behaviors that reduce the spread of COVID-19, but also had certain costs which I had to bear. For instance, avoiding travel, getting vaccinated, wearing a mask, there are certain costs associated with those actions, even though they had a positive externality associated with them. So the next thing was there were certain people whose risk of dying was much higher. The vulnerable, the immunocompromised, the elderly, and some certain groups who were genetically predisposed to dying from COVID-19. So if I was at a lower risk, the cost of me bearing these behaviors, these public health measures to prevent the spread was much more because the benefit to me was much less. The probability of me getting an infection and dying was way more less than somebody else who was immunocompromised or elderly getting it. So it was unique in all those senses. And the world managed though, but it was a huge sort of a lesson, a case study in human cooperation and how we manage collective risk. And I think it is worth studying that how COVID-19 preventive behaviors could have been better optimized and looked at so that we could have gotten our people to be more cooperative and reduced the cost and the risk to everybody else.
So Harshit, I think you just laid out the argument in a very clear fashion. So just wanted to understand, right? So you said that you were not directly impacted from COVID-19 as much as, say, the elderly or those who are at risk. But how does the individual benefit from avoiding infection compared to the cost associated with, the preventive behaviors that you want to sort of inculcate?
Yeah, so I think here is where we come in. So basic economic reasoning 101 and even experiments before COVID-19 has proved that people tend to be more pro-social or more sort of less looking at being reducing their benefits, reducing the cost associated with whatever they do to maybe increase benefits, perceived benefits to other people. So COVID-19 was very unique, even though there was some chatter and there were certain things that people didn't want to undergo behavior. But by large and at large, under certain government corrosion and under certain pressures by the government, I think most of the population around the globe did cooperate and they undertook costly behavior. So there are like two, three things which come to mind. First is the pro-social behavior that human exhibit. Then there is the kinship phenomena, which I think is very important. And if you extend the kinship phenomena, maybe you can extend it to maybe ethnicity, maybe to the large group thing we have. And then there's also certain aberrations which economics is not able to explain. That, for instance, why am I more likely to maybe get vaccinated, even if maybe I have a very small risk of getting an adverse effect or have a cost associated with going and getting vaccinated to prevent infection, my old neighbor from getting that infection. So there are like certain behaviors, certain phenomena which can explain our costly behavior so that others can get a benefit. So humans are not as bad as we think they are. They tend to be more cooperative and more pro-social than our understanding was like 20, 30 years ago.
That's interesting. So you spoke about pro-social and the kinship, as being like very important factors here. Can you just define what you mean by pro-social, kinship, and what were the different forms of messaging on increasing COVID-19 preventive measures?
Yeah, I think I'll take your first question first. So, kinship is basically what we have been studying for some time, and I think we did a few episodes, and we also have some literature out there, and you can always like hit us up if you want to know more about that. A lot of people tend to undertake a lot of costly behavior for their kids. This is what we have studied for blood related kids. So, for instance, parents are willing to undergo massive cost for educating their kids, getting them maybe good facilities, maybe even organ transplantation. This cannot be explained by other things. So, kinship explains a lot of costly behavior which does not fit into our normal cost benefit analysis and normal economic 101 analysis. So this is helping us supplement that. So, and pro social. So humans are a very pro social sort of a species, and we have found out that we tend to help other people more than what our model suggests or what our understanding suggests. So we tend to be a pro-social species as whole. Some cultures more, some cultures less. Usually, Western civilizations, Western sort of countries called the weird society. Weird is Western educated, industrial, rich, and developed. They tend to be more individual centric, and society like ours, like India, Southeast Asian, maybe African countries, tend to be more family and kin based. And at least in those circles, we tend to be more pro social than what is usually expected and what is usually sort of what we think we will be. Coming to our second question. So, messaging in terms of maybe the concept we are talking about right now, the difference would be, for instance, if I, instead of the normal public health angle we put into messaging, I try to play the angle that, oh, so you don't want to take public health measures, you don't want to wear a mask, you want to go out, and you don't want to get vaccinated. So your kids are the first one which will get effective, which is true to a lot of extent. So I can also say that if you don't do this, your community will get affected a lot, and then that is the loss for you as well as the community. And if your community in India, so there's a saying which says that, I think Nitin says that a lot, that India is basically a country of thousand communities or countries put together. So we are still at that level. So if your community is weak, if all people from your community are sick because you were not willing to take public health measures, then who would come to help you out? So because of whatever XYZ reasons, the government is not that efficient and whatever, and it depends on your community for when you're sick or when you're down. I think these are certain twists or certain angles we can add to our public health messaging. Certain countries did. We didn't do it very successfully, but certain countries did that. There is no hard data which tells it, but logically it should have better results.
All right. So, Harshit, let's take a short break, and when we come back, let's discuss the rest of what you have to offer. Hello, and we're back after that break. So, Harshit, like you've been, giving us a sense of how kinship, pro-social behavior comes in for a social dilemma like, COVID-19 was. But what we also saw during the pandemic was a lot of uncertainty, lack of clarity of what to do. So, how do you explain, the uncertainty that prevailed around COVID-19 as a social dilemma? What were those challenges that came out of it?
So, uncertainty in this context, we have discussed it earlier in the climate change conversation we had around balancing policy, and a few weeks earlier also, and in multiple informal conversations. So, uncertainty, what it leads to is uncertainty in time in this context. For instance, I don't know whatever I do now will lead to a good outcome in the future. For instance, I don't know if me taking vaccine will prevent me getting infected in the future. There's information, there's data which says that, but there's also an uncertainty. There's also uncertainty which says that if I don't know if there would be another wave in few time. If I don't know how the next variant would be, will it be more lethal? Will it be more lethal for young people? Will it be more lethal for diabetics? Am I more likely to get like much more affected this time? So there's a lot of uncertainty. Uncertainty in future has been proven to reduce cooperation in the present because you don't know what will happen. So you are much more less likely. You are basically much less likely to take costly behavior, to undergo costly behavior now to prevent in a future outcome, to prevent sort of like costs to other people. So pro-sociality and sort of kinship related behaviors and taking costly behaviors for other people goes down in this period. And yeah, there's also a lack of information, which was obviously, along with lack of information, fueled by misinformation along this time.
So coming to the concept of misinformation that you spoke about, what do you think contributed to this, right? Because on the one hand, you want people to get as much information as possible, but there's also the problem of information that just goes out of line, right? Information that's not trustworthy. So what did we see during the pandemic that made misinformation a social dilemma?
Yeah. So it's a very interesting question, and I have a very nice take on this. First of all, what is called the costly information theory. And I have a very nice example to go with this. So, yeah, what happens is that people tend to try to minimize the cost they expend to acquire a piece of knowledge or a piece of information. So, what they do is they will try, for instance, I'm looking, this is an old example, I've given it like many times. So, for instance, I join a PhD department and I'm looking at, oh, so whom should I emulate if I want to get tenure? So I look at professors. So I look at professors and see, oh, so this is the professor who got tenure. These are the like four professors out of the 10 who got tenure. Maybe I should do whatever they are doing. The next level to this would be I would see how people behave to these professors. So the professor who gets the most prestige or the most respect would be the one who is most successful in their field. And maybe he's the one who is, if you follow them, he's most likely to get tenure. The third level would be if out of these four, I open their CVs, I look at all their papers and decide who would be the best for me to emulate. So, but by the time I've reached third level, I have expended a lot of energy and resources. Humans generally don't want to do that because you want to do acquire information to be on how to be successful in a minimum while expending minimum energy. So this is what contributed to misinformation because you didn't want to. For instance, if somebody shares something on maybe any of the social media platforms, if somebody tells you something, you can always go and fact check this. And even if you are not satisfied with the fact check, you can go and look at the original source or maybe look at literature. But you will not do that for everything because there's a cost attached to that. So first is this. Second is for the person who is sharing, there is the costly information theory which applies to them. So they don't believe the information to be false or misleading. They just believe it to be true and don't fact check it. So they share it. The first one is on the receiver's end, and the second one is on the sender's basically end. And third, this was a very small minority of people who shared false information deliberately to maybe get more engagement on their content or maybe get more famous or maybe they wanted to mislead people. This was, let me remind you, this was a very small section of people. So all of this sort of fueled the misinformation crisis or the misinformation phenomena around COVID-19.
So, having understood and described what the misinformation crisis looks like, what do you think were the potential solutions to sort of stem, the spread of misinformation, right, during the pandemic?
Yeah. So coming to a question, misinformation seems to be fueling a lot of sort of like social aspect of the COVID-19 crisis or any crisis like this. The thing with this is that there are like certain solutions. And before I even speak the solutions, I know with every solution I suggest there are like 10 problems associated with that. The moment they come to my head, I have like a 10 like a page long problems associated with that. For instance, professional fact checkers. We would want people to like sit and maybe this could be AI assisted, but we want people to sit and like assist on whatever misinformation is going around and stop that. But this is a very costly process. And but if you crowdsource this, so you move the cost from the media platforms to the users. But then the users must incur and must donate their time without compensation. So this is also sort of a cooperative dilemma. But because why should users donate their time for a collective crisis? And that too, which misinformation has led to a decrease in cooperation and pro-social behavior. The second thing is eventually, so I am wrong on this on like a lot of levels. Eventually, the responsibility for the crisis lies with the media corporation and the maybe the politicians. So in a way, it may be their responsibility to stop that, but that I don't see that happening. That platforms taking up responsibility, and maybe they shouldn't. I'm not very clear on this, and my arguments are not very clear on should media platforms be taking responsibility for whatever misinformation goes through them or should they be like actively trying to stop them because the cost associated with trying to stop them is like huge. So yeah, so but we'll have to stop this. We'll have at least try to find ways to lessen this misinformation crisis because if we don't, this will fuel and reduce. This will like basically reduce or whatever cooperative behaviors we do in a social dilemma like COVID-19.
So, Harshit, thanks for those insights. And yeah, we'll be sure to sort of link up some resources in the episode show notes. So, yeah, just in conclusion, I think you wanted to just tell our audience about an upcoming event that you're going to organize at Takshashila. So, yeah.
Yeah, yeah. So we have a learned society for the biology and policy sort of program we have. So on Friday, this Friday, 2 to 4 at our Church Street office, we'll be discussing climate change through the lens of biology and policy. Please do come if you're in Bangalore. It would be a very interesting conversation, interesting idea, interesting conversation with interesting people. And we do have like decent snacks. So do come, do join us. I'll put the form for RSVP in the description. Do come and do join us. I think we need people who are thinking in the same way as we are, and we need to improve the discourse of public policy and public policy delivery in this country.
All right, that should be an interesting event. I'm sure most people in Bangalore would really benefit from attending it, and yeah, I'm going to be there. So, looking forward to it, Harshit. But thanks for sharing your thoughts on this subject of a social dilemma like COVID-19 and the consequences that society, individuals faced. Yeah, we'll be sure to sort of do a few more along these lines. But for now, that's it from us, folks. Thanks for listening. Thanks, Harshit, again.
Thanks, Carl, for having me. Thanks, everybody, for chiming in and listening to us. Please drop in if you have some comments. We are always looking for feedback and we want to connect with more people who think this is an interesting way to look at things. Bye bye.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.